Hi, my name is Kaiser Mitchell. I'm a student physical therapist assistant with Jeff State, and today we'll be talking about PNF activities for transtibial and transfemoral amputees. All right, so what is PNF? PNF is proprioceptive neuromuscular facilitation, and we use these methods to just improve overall function of patients, improve their mobility, improve their strength, and really just progress them in physical therapy. The goal of PNF for any patient population is to make it easier for them to perform a motion or some posture. Um, so yeah. So what we are working with today is, and what we're going to be talking about is transtibial and transfemoral patients. And what transtibial means is just a amputation below the knee, and transfemoral means an amputation above the knee. Once patients have this type of amputation, the body goes through many changes and changes in function, and it's important to just help these patients get back to as functional as a level as possible. Some of the benefits for both AKAs and BKAs, aka above knee, BKA below knee, is these PNF patterns, but we want to first make sure they are healed first. Um, Once they are healed, we can improve strength and control. We can enhance proprioception and balance. We can facilitate trunk and pelvic stability. We can help with muscle re-education, and we can prepare them for weight training. The three main regions that we want to focus on with these type of patients is the pelvis, the trunk, and the hips. For the pelvis, we would like to position the patient in side lying, either on their sound limb or their residual limb, and the patient will perform anterior elevation and posterior depression. Anterior elevation goes up and forward. Posterior depression goes down and back. You want your manual contact to be on the iliac crest, and also the greater trochanter, ischiotuberosity. Using a quick stretch pattern is indicated for an amputee who has difficulty initiating the swing phase of gait. Another good technique is using agonist reversals. It's really good for control and weight bearing activities. So how this might look, I have a video right here. So notice how in the video he's pulling her down into that depression and then up into that anterior elevation, posterior depression, anterior elevation. Notice how he's doing this technique. He started off by doing all of the motion, and then he'll progress to her helping out. Let's keep moving. All right, next we're going to focus on hip patterns. For the hip and the whole lower extremity, there are four different techniques you can use: D1 flexion, D1 extension, D2 flexion, and D2 extension. Here's a little list about what happens during each one. We're going to look at a video to kind of show us how to do these patterns. All right. First, we're going to look at a video of how it would look on a normal patient. So as you can see in this video, patient has a sound limb. Manual contacts are on the inside of the foot, side of the thigh, followed by the outside of the foot and the outside of the So notice how we had to change the manual contact slightly for a patient who is an amputee. It's still going to facilitate the same motions, flexion, extension, abduction, and adduction, internal and external rotation. You just have to change your manual contacts to accommodate for somebody who's an amputee. For the trunk patterns, a therapist can pick activities to help with gait um, and rolling over in the bed. Both activities are effective and are needed for patients with AKAs and BKAs. Um, for a patient to facilitate rolling, I have a video on the next slide for that one. But basically, what you're going to do is you're going to get the patient to bring the shoulder into anterior depression and the hip into anterior elevation, followed by bringing the shoulder into posterior elevation and the hip into posterior depression. The combination of these two movements helps with rolling in both supine and prone, which may be hard for a patient following amputation. To help with walking, rhythm and stabilization, and alternating isometrics can be used to increase pelvis and core stability. Core and pelvic stability are key for gait training and weight bearing on both sides of the residual limb. Next, we're going to look at this video. Start with this video right here. I'm going to skip a little bit forward to where it actually does it. She's doing some alternate isometrics. Did push back right there. So she's doing a combination of pushing back and pushing forward. This is really good for stability. It's going to help with walking. Now let's watch this other video. It's going to help with rolling. Watch it again. One more time. So we got the shoulder and the hip both coming forward, and the shoulder and the hip both going back. That's going to help facilitate rolling. You're applying manual resistance with both of those. In conclusion, there are many different PNF activities that will benefit for amputees. It is important for therapists to work with amputees with the same goal in mind as if they were working with a patient who didn't have an amputee. Um, a lot of times people try to treat patients that have disabilities or have something that's um, different from the rest of the population, but it's important to just treat them like everybody else. The goal is always to progress the patient to their best functional ability. If you try these different PNF activities with a patient, we should be able to get the best functional outcome. Thank you. And this is my presentation. Y'all have a good day.